dialogues on health, and we are still continuing with our issue on infertility, and today we're joined by Dr. Sichimwa. We are going to be talking about fibroids and how they affect fertility in women. Welcome, Dr. Sichimwa, to our program.
Thank you very much, Sharon. And thanks to the viewers and listeners for joining us.
Thank you so much for partaking in this program. So as we're beginning to divulge more into how fibroids affect fertility, I think it will be good for us to start by defining what fibroids are and where do they occur in a woman.
Okay, thank you very much for the question. I hope you can hear me with this mask. That's not moving, but I'll try and speak louder. Okay. Before I answer the question, let me just introduce myself, Sharon. I'm Dr. Sichimwa. I'm an obstetrician gynecologist. I've been a specialist obstetrician and gynecologist for the past 8 years, and mostly in private.
Wow.
So I think, to come back to your question, fibroids. Let's start. What are fibroids? They are called fibroids, they are called myomas. Basically, it's the same thing, it's just a nomenclature. But fibroids are benign growths that grow in a uterus, in a woman's womb, what we call a uterus. And there are several types of fibroids, basically, and every woman has a risk of developing fibroids. Basically, a lifetime risk of developing fibroids. As long as you have a uterus, there's always a risk for fibroids to grow. They grow from the uterus, and we'll discuss more about that.
Okay. So some people have a notion that when you develop fibroids, it's similar to developing a growth or cancerous growth. Is it true? How is it different from a cancerous cell growth?
Yes, thank you very much. Fibroids are benign. By benign, we mean they are not cancerous. Okay, so by and large, they are benign growths. Okay, except very rarely, the small population, but usually in the elderly, very small percentage that can transform and become a cancer, what we call a sarcoma or a leiomyosarcoma. But that's very rare, and there are always ways that differentiate that from the usual benign fibroids.
All right. So what are the common types of uterus fibroids?
Thank you very much. I don't know if they are able to see this model. The fibroids, for example, let's say we diagnose you with fibroids. These fibroids are growths. So as you can see, it will be something like that. As you can see, this is a model of a uterus. Basically, that's the uterus, the ovaries, the fallopian tubes, and the uterus with the cervix and then the vagina. So, like we said, fibroids are growths in the uterus. It's benign growths, not cancerous growths, and they can grow. They can grow inside, in the cavity of the uterus, what we call submucous fibroids. And obviously, these ones are the ones that may interfere with fertility because they grow where the fetus, the embryo, is supposed to grow, in the cavity. Okay, and then you get others that grow within the wall of the uterus, what we call intramural fibroids. Okay, and these are different characteristics. The way they will affect fertility is also different. It will depend on the size and where they are within the wall of the uterus. Okay, and then we get what we call the serosal fibroids that will be mainly outside, or even those that may hang on the uterus that we call pedunculated fibroids. Okay. Yeah.
You mentioned the type of fibroids that are found in the uterus that compromise the growth of a child. So is there any treatment in this type of fibroids?
Yes. Thank you very much for the question. Fibroids are basically treated with growth, and the treatment is usually depends. Basically, what happens is when you have fibroids, most women will have fibroids without even knowing that they have fibroids. Okay? So, but in those where they may cause symptoms, And what symptoms are we talking about? There may be pressure symptoms, if they are too big, pressure symptoms, pressing on your bladder, pressing on your bowel there. So you may get pressure symptoms. So if I find a woman coming and say they constantly feel this pressure there, or they have to be running to pass urine most of the time. Okay? They may cause heavy bleeding. Okay? Some women will just present with heavy bleeding. That something is not right with their cycles. Whether they bleed heavily, they lose a lot of blood. Some even to a point of needing blood transfusion. Okay? So it's that, the pressure symptoms, the pain, the bleeding, and others will just say, look, we've been trying to fall pregnant, 1 year, 2 year, baby is not coming. Can we check? And you end up finding fibroids. Okay. And others will just come for a routine gynecological checkup, no symptoms, and you pick up fibroids. Okay. So by and large, the treatment is mainly depends on the woman's desire or what the problem may be. So just finding fibroids does not mean you must remove. Okay. And the treatment for it depends really on what needs to be done. So it's either expectant, where you just follow up a woman, for example, a woman who's not having any problems. You just picked up the fibroid, and you just need to follow up. They don't need any specific treatment. And then there can be treatment again, medical treatment, where we just control the symptoms. If it's the pain, you get the pain tablets. If it's the bleeding, you get something to control the bleeding. So that is medical management. You control the woman's symptoms. And eventually, definitely, treatment for younger women. If a woman still is to have children, then the treatment is what we can offer them is a myomectomy. Myomectomy, basically just means the removal of the fibroids, the myomas only, without removing the uterus. The way you preserve a woman's womb. So she can still have babies, she will still have her periods. Okay? And all of the definite treatment, and that is offered to women who fit a certain criteria, is the hysterectomy, where you remove the whole womb. Okay? That's for women who are old, women who have completed their families. Basically, they no longer have any use for the uterus. Then hysterectomy is the definite treatment for that.
Okay, talking about that procedure where these fibroids are removed, is there any chance that maybe something could go wrong and affect the whole uterus from conceiving totally?
Yes, everything can go wrong. That's why the issue of informed consent comes in. Okay, so before the procedure is done, a woman is explained to everything that can happen. Okay. And the removal of the fibroids is not guaranteed that you remove them, the baby will come. Because there are instances whereby women do not fall pregnant, and not because of the fibroids, but from other reasons. So whether you remove the fibroids or you don't remove the fibroids, there will still be no baby there. So counseling it becomes very important, how the woman is counseled. So look, we will remove these things, and there is no guarantee that baby will come. We are trying our best. And obviously it's a surgical procedure. Two ways of doing it. Obviously they can be done laparoscopically, where we just put keyhole surgery. For women who fit that criteria. And it's usually women with very small fibroids, small number of them, 1, 2, 3, okay? Or open surgery, where the woman will have an incision, a scar, and whereby all the fibroids are taken out. Each of them has advantages and disadvantages, really. Yeah. And by and large, the problem is that most of the time the fibroids that we tend to see, they are big fibroids, and a lot of them, where you can really remove up to 50 fibroids from a woman's womb. Yes. So, yeah. So the operation is either laparoscopy or open surgery. Most of them are done by open surgery. There are advantages for that and disadvantages for that. Laparoscopy, advantage and disadvantage. Yeah, that's how it's done. So there is no medicine that you can drink and then the fibroids are gone. Medicine is just, to give you medicine is to help control your symptoms, which is usually pain, usually heavy bleeding. But there is no wonder medication that you drink and then the fibroids are gone.
Okay. As you mentioned that there is no medicine particularly for that, there's been a trend in this day and age where people are promoting what they call stem, stem something. There's what is it? It's a treatment where they use apparently they call it stem cells, something like that. And they have been, I don't know whether they are real doctors on social media that have been promoting those products, saying that they can be used to treat fibroids. We've also had some doctors referring patients to have this sort of treatment that's herbal, like they say apparently it's organic, and they have been saying that this has been helping. I don't know whether they are real doctors on social media or people are just using it to promote their own products.
Yeah, well, thank you very much. I think those are really non-conventional methods, and it's really more to treat the mind than the fibroids as such. Yeah. And remember, for treatment to work, people must believe in that treatment will work. So people may believe that, well, since I started taking these herbs, my fibroids are no longer troubling me. Yeah, it's the mind. Yeah.
Okay. Alright. I like you mentioned that when the fibroids are removed, someone can still not conceive even when the fibroids are removed. So just for the benefit of those that are watching, is there any specific behavior or diet that is encouraged for women to increase their fertility?
Yeah, thank you very much. Fibroids. Remember, I said that not all fibroids cause infertility. Okay, so it's certain types of fibroids, mainly where they are located, how big they are. Okay, in the absence of other factors. So, for example, because remember, before pregnant, your tubes, fallopian tubes must also be open, must be tightened. So, for example, for someone who has blocked tubes, maybe they had previous infections or previous multiple surgeries, when the tubes are blocked, and now you find out they've got fibroids. So, fibroids you can remove, but that natural fertility will still not come because the cause of the infertility was not the fibroid, was other things. So removing the fibroids, you will normalize the uterus, and obviously if natural fertility does not come in that case, then there are other options where they can still fall pregnant. That's always a very important message that should be given to women. Okay, so you remove the fibroids, you normalize the womb, and obviously if it's try to prepare for fertility, then yes, with an absence of natural fertility, then other options are considered, such as in vitro fertilization, where the uterus is normal. And remember, the interval also does matter. If you remove the fibroids now and there's still no pregnancy in the next 5 years, a good percentage of women will have a recurrence of fibroids. So they tend to grow back. That's what takes us to that point where I mentioned that the definite treatment for older woman, someone completed family, no other issues, is hysterectomy. Then you remove everything out and the problem is solved once and for all. But for younger women, mastectomy is the way to go, so that they can still have the uterus, they can still be able to have babies.
So you mentioned that the elderly can have the uterus removed. Now, if their uterus is now removed as the elderly because they don't plan on having children in the future, does it affect their sex drive or their hormonal natural way of, having?
Thank you very much. Not at all. Hysterectomy. Remember, also hysterectomy refers basically to just the removal of the uterus, not the ovaries. The ovaries is what produces the hormones, what determines whether you go to menopause or not. The hormonal imbalance is what will affect your well-being, sex drive, all those things. It's hormonal. So hysterectomy will depend. If you are removing only the uterus and the woman is not in menopause, there shouldn't be any issues. If the woman was already in menopause or for some reason, even if she's still a young woman and the ovaries were removed, they will go into what is called menopause, surgical menopause, because you have removed the ovaries. And usually that can be corrected when we put them on hormone replacement. Try and replace. It won't be everything that the ovary was producing, but it will be part of the hormones that the ovary was producing that they will get. Yeah.
So if they remain with their ovaries, does that mean, suppose they remain with their ovaries but then they're still not yet at the menopause side, will they still bleed?
No, they will not bleed.
Okay.
Because once you have removed the uterus, there will be nowhere the bleeding will come from. So there will be no bleeding, there will be no babies.
Okay.
But everything else will continue. Hysterectomy, we don't close the vagina, so the vagina will still be functioning.
Thank you very much for the Dr. Sichimwa. Thank you so much to our viewers. If you have any follow-up questions regarding to this discussions, feel free to email us on info@africahealthcc.com, and we'll let you know what you're inquiring about in our next segment. Thank you so much for watching. Thank you very much for your time, Dr. Sichimwa.
You're welcome.